And reporting. New research suggests young Australians are putting off trips to the dentist as the cost of living crisis deepens. For more, we're joined by Dr. Monica Farrelly from the Australian Dental Association. Thanks for joining us, Doctor. Can you tell us a bit more about this research? What does it show?
The findings show that 18 to 25-year-olds are increasingly delaying seeking dental care, often due to cost, time pressures, and navigating healthcare independently for the first time. One of the most alarming statistics from the survey was that 60% of 18 to 25-year-olds are experiencing problems with their wisdom teeth, being pain, infection, crowding, or swelling. The survey also showed us that 60% of Australians say social media has influenced their decision to get cosmetic dentistry done, and only 38% of individuals in the 18 to 25-year-old age group are wearing a mouthguard during high-impact sports. Together, these findings paint a really clear picture of a generation that is at risk at falling through the cracks, delaying urgent dental care until problems become really serious or painful.
So, Doctor, to what extent are we seeing a drop-off in dental care when kids transition into adulthood?
This is a really critical age where 18 to 25-year-olds really become independent for the first time. It's often the stage where they move out of home, they start paying for their own dental treatment if they come off their parents' private health insurance. They may no longer be eligible for any government schemes, and as a consequence, they don't prioritise going to the dentist. In conjunction, they have, increased living pressure costs, rent increases, they're trying to manage a very busy study or workload, and dentistry just doesn't become important to them.
Do you think some young people consider cosmetic dental treatments to be the same as going to an actual dentist?
Most definitely. It's hard for them to not feel that way when they open their social media, they open Instagram, they open TikTok, and they're inundated with influencers or individuals who are not health professionals or dentists actually providing them advice about cosmetic dentistry. When the lens becomes focused on beauty and cosmetics and not healthcare, you can really see how disease prevention doesn't become as important or is really not the focus when you're not in pain.
Okay, so what are some of the consequences we're seeing from people delaying this dental care?
I work as a dentist, and every day I see the consequences of people delaying dental care. Often problems that maybe started as small and manageable can develop into something really acute, quite painful, and then it becomes more expensive, more invasive, and often more complex to treat. Ultimately, it's the patient who ends up in a more difficult situation when they're delaying treatment of things that could be completely preventable.
And what about the pressure that places on our healthcare system?
It's a big burden on our healthcare system. I had an individual this week who told me a story of how they were having problems with their wisdom teeth, for example. Because of the cost, rather than going to see their dentist, they went and saw their bulk billed GP, and then their GP referred them to ED. That's a direct cost to the healthcare system with something that's entirely preventable. So it has so many flow-on effects. At ADA, we're always advocating for the mouth to be considered as part of the overall health and stressing the importance of that integration with government considerations.
All right, it's a good reminder to make an appointment. Dr. Monica Farrelly, thanks for joining us this afternoon.
Thanks for having me, Hugh.